Thank you, Hindi team. Thank you. Now we are starting the English session. Before that, thank you, Hindi team, and Happy New Year to all.
Happy New Year to you,
Happy
ma'am,
New Year,
also.
ma'am. Happy New Year,
Thank
ma'am.
you so much. Love you all. And now we are moving to our English session. Today is our 1948th day of continuous webinar. Thank you all the participants and faculties for your participation here. And we'll begin with a silent prayer. Today's our guest is Dr. Prakash Rao. Today is our 1948th day of continuous webinar. Today's our guest is Dr. Prakash Rao. He's BA and PG in Rehabilitation, MD, PhD in Homeopathy, a retired research officer in Central Council of Homeopathy in Government of India, more than 30 years of experience in CCRH, and undertook the projects with UNICEF and AIDS Control Society. He is successfully treating infertility in homeopathy, and now he is taking fifth part of infertility in homeopathy in the research part. Dr. Prakash Rao has joined or not? Sir, you were talking about something about the sleep. Sleep. No, you can continue up to the doctor. I think he will join now. For 5 minutes, you can talk.
Dr. Kalyan Swarup is a present.
Yeah, Dr. Kalyan Swarup here.
Or reference Dr. Kalyan Swarup, onion during sleep.
Please unmute, sir. I just send you the request. Please unmute and please talk. Actually, this forum is for the discussion also. So we are not spending more time for the discussion. So now we'll continue the discussion. We'll wait for 5 minutes to join. Let me confirm with Dr. Danesh.
Hello, Dr. Kalyan Swarup is a sir. Please unmute and golden tips in this webinar.
I made you as a co-host, so you can unmute yourself and
unmute करिए sir. Dr. Kalyan Swarup sir, unmute कीजिए ना.
Sir Ram Parvesha sir, you can talk. Dr. Kalyan Swarup will talk later. I think he's not in a mood to talk. Is it sir?
सेशन तो हिंदी था, अभी तक इंग्लिश ज्वाइन हुए नहीं है, तो हम हिंदी सेशन में टॉक करते हैं.
मुश्किल नहीं
हिंदी
हिंदी मुश्किल नहीं. Dr. Danesh.
Dr. Prakash Rao has presented fourth part of this infertility, and already 5 parts have been done, but this is on PCOD. We know that PCOD is a different subject, but we are getting a lot of patients every day. But unfortunately, we are not recording everything and publishing the same. That is the biggest challenge in front of us. But actually, every homeopathic doctors can do research work in that line. So if you treat 10 cases, then you upload the same into our website, and then only people will be aware about it.
Danesh, yes. Dr. Prakash Rao has joined.
Yes,
you are welcome, sir. We already introduced you, and you are welcome.
I am admit, Dr.
Unmute yourself and.
Dr. Ajini, please introduce once again so that we can take the video from that onwards.
Okay.
Otherwise,
today is the 1948th day of continuous webinar. Our guest is Dr. Prakash Rao. He is BA and PG in Rehabilitation, MD and PhD in Homeopathy, retired research officer of Central Council of Research Homeopathy in Government of India, and more than 30 years of experience in CCRH, and undertook the project of UNICEF and AIDS Control Society, and he has taken 4 session class about the infertility. Today is the 5th part of his continuous class. Thank you so much, Dr. Prakash Rao, for being with us. You're welcome, most welcome, please. Sir, you're welcome, please.
Sir, can you hear me?
Yes, sir, of course.
I am speaking from my desktop as well as from my mobile phone. Please, you connect me for both of them.
Yeah, I made you as a co-host in both.
Now you kindly allow me to join and Zoom enable camera.
Yeah, you are the co-host, sir. So you can open the camera and you can share the
Oh,
video, sir.
slide.
Okay.
Okay, madam.
In your both mobile and computer, I have connected.
Yeah, 1 minute. All right. Thank you. Right, sir. I have taken much time. Almost 15 minutes are over. Please, I will one by one just I will make you to recollect as early as possible the previous lectures which we have given. You know everything. This is about infertility. I thought that in infertility I can cover the medicine of Agnes Castus and Murex, which have worked more in our research methodology. What we found, but when I found the topic, topic was so big that I could today provide my data only on Agnes Castus. So let us go through the previous lectures, which just make you to naturally to understand. Just refreshing you, I am showing the slides. See, diagnosis after 1 year of frequent, unprotected combination, then only it will be known as infertility. See, etiology, endometriosis, interference with tubal potency, endometrial pregnancy, adhesions, and the treatment convention is laparoscopy and other. Then there will be tubal blockage, scarring, PID, pelvic infection disorders, fibroids, uterine problems, tumors, and congenital anomalies. Anovulation, they will be genetic, hypothyroidism, stress, and decreased body weight. Then anovulation, menotropics, paragonal, repronex, and extracted from the urine of the postmenopausal women. See, these all you know very well. Then cervical mucosal problems, vaginal infections, hormone deficiencies, treatment with HRT, hormonal replacement therapy, cryosurgery, and guaifenesin. See, these are all which will cause female infertility. Then in male factors, varicocele, cryptorchidism, that is undescended testes, restricted to undergarments, see, very tight undergarments and driving the cycle, occupational exposure to heat, working in a seated position, always continuously sitting position. Then immunological factors, autoimmune reactions such as mumps, production of antibodies that destroy the sperm. This is very common in mumps. See, most of the mumps patients who suffered with mumps at the earlier age of their life in the childhood, they will become infertile and their spermatozoa production will be stopped. Obstruction sperm, I told, mumps and epididymis and sexually transmitted diseases. The assessment again is general health, nutrition, alcohol, drug abuse, congenital health problems, illness such as mumps and orchitis. Then operation, surgical repair of hernia may cause disturbance to seminal vesicles or seminal tubes. So there will be infertility. Current illness, endocrinal, past and current occupational hazards, and current past reproductive tract problems, endocrine problems, abdominal or pelvic surgeries, use of vaginal douches and medications in female, occupational exposure to X-ray and toxic substances. Then menstrual history in female, age of menarche, length of regularity, amount of the flow, dysmenorrhea, premenstrual syndromes, contraceptives they are using, previous pregnancies or abortions. They are most important in assessment of the history while taking homeopathic case record. Then basal body temperature, oral temperature taken each day. Results are graphed. Sudden dip occurs in the day of prior to ovulation. So we have to see the menstrual cycle and we have to observe the patient during the menstrual cycles in females. And serum hormone testing, venous blood is done to assess levels of FSH and LSH. See, follicle stimulating hormone and luteinizing hormone. They depend upon the ovarian functions. And post-coital examination, couple has sexual intercourse 8 to 12 hours prior to examination. These are the standard protocol designed treatment expectation and treatment analysis for treating the infertility cases. Then collect of specimen for secretions from vagina, and secretions are examined for active non-motile sperms and sperm count consistency in the cervical mucosa. Then endometrial biopsy has to be taken. Paracervical black and decrease in cramping. Pinch endometrium obtained to check for a luteal phase defect. Instruct the client or patient to understand the below ways. Assist on examination table. See, these are the female investigations that we usually carry. Endometrial biopsy and provisional sanitary napkins that are being used and which they are causing the infection. Assess of vasovaginal response, fainting caused by hypotension. These all factors must be taken into the consideration and kept in mind before prescription for starting to treat the infertility in female. Then in females, that detects uterine anomalies, tubal abnormalities, iodine-based radio opaque dye installed. These all must be considered while taking the case record. Then laparoscopy, epidural anesthesia, abdomen insufficient carbon dioxide is present in abdomen if it is bloating abdomen, which will eject and force the spermatozoa out of the vaginal wall. We have also find one of the rubric in our lycopodium that flatus passes through vagina. Now the latest investigations and scientific experimentation has shown that excess flatulence also passes through the vagina, which was observed by homeopathic doctors around 200 years ago, is a verified rubric now. And these all laparoscopy visualize structure of the pelvis. If the pelvis abnormalities are there, the pelvic abnormalities have to be rectified. So then in male, semen analysis, ejaculation, number, ejaculate exam for morphology and motility, volume, pH value, total sperm count more than 20 million, motility 50% or greater, normal forms, that means the spermatozoa should be with the head, neck and tail, and they should have at least 50% anti-sperm antibody evaluation. The cervical mucus and ejaculated are tested for agglutination. Indication for secretory immunological reactions. Nowadays, we are finding most of the young people suffering from bald-headedness. That is just because the testosterone antibody will be secreted in the body once the testosterone levels in the body have increased. To prevent the psychology and normal sociological aspect and to create an awareness of the social responsibility, the testosterone antibody will be secreted in the body. That testosterone antibody will prevent and it work on the root canals of the hair, and there will be a balded headedness most probably in front, and that is the reason why the young generation are having more bald-headedness, because of the strength and secretion of excessive testosterone that is leading to testosterone antibody formation. And usually we have to see the shame, guilt, stages of grief, and we have to communicate, listen, and support groups. compromised family coping, knowledge deficit, anxiety situation, low self-esteem, educational needs, perform various procedures, semen collection, meaning in the results of the test assessment, self-monitoring during medication, how to assist reproductive technologies that are performed. Then hormonal therapy, if it is given, if it is needed under the integrative medicine, because the immunomodulation changes are needed means we can do with homeopathy. But if the hormonal replacement has to be done means we have to replace the hormone along with the homeopathy to overcome the immunomodulatory changes. So this is a new style of integrated medicine which we can practice. Then medications, these are all allopathic medicines usually which we have to be educated and create awareness, because we receive all the cases after being failed by allopathic doctors, and the literature, the research which we have done, we found that there won't be any fresh case that is coming to homeopathy. Most of them are particularly infertility. Usually that is very common in any chronic disease, but nowadays the awareness has been produced against allergic bronchitis, bronchial asthmas, respiratory problems, and joint pains. But so far about infertility, nobody knows. So somebody refers, some of the allopathic doctors will refer the case to a homeopathic doctor. So we must be having a profound knowledge of conventional medicine so that it will help us to prescribe homeopathic medicine and to follow up the case and to show the results within 1 day to 6 months of the duration. Then ejaculate, centrigate, these are all methodology. Sperm are again centrifuge, these are how we have to conduct intrauterine insemination, an artificial insemination. Even the artificial insemination can be carried out by homeopathic doctor if they are having especially infertility clinics, so that taking the help of small gadgets is not wrong along with the treatment. And in vitro fertilization is the choice of the treatment in allopathy. Once the in vitro fertilization fails, then only the patient will come to homeopathic practitioner. So cyst and ovaries, multiple buds, ovarian hyperstimulation, these all are the side effects of the intravenous artificial insemination. So this has to be kept in mind. Usually they fail in 20% of the cases. Those 20% of the cases will come to a homeopathic doctor. And so we should have knowledge of all these things. Then pre-procedure care, that what they take, that also will create an infertility, unnecessary sedation, oval interval procedures, administration of synthetic FSH, they all will have enormous effect on temporarily causing infertility in female when they are undergoing treatment in infertility center of conventional system of medicine. So we have to keep all this knowledge, and we have to keep this knowledge in our mind. Then we have to carry out the embryo placement progression. These all are, once they cross this stage, they only come. So I will pass on this to cover this. Then we have to answer the following. What medical and surgical history questions will we ask? What medical and surgical history questions? When we ask the patient to expect initial assessment of her fertility, how will you answer? These all are just you will understand in your awareness programs of infertility. I need not show. Then if everything fails, we also educate the patient, including homeopathy fails, adoption, surrogate mothers, childless living. We also have to educate, because every doctor who treats 100 cases, they definitely will fail with homeopathy in 2% of the cases. So we have to show them the answer, and we have to show them the way for substitute the infertility in their life condition. So this is one of the, then I will share my next part. One minute, sir. Just wait for a minute. And can you see this slide, sir? Infertility causes, challenges, and global response. Here I want to show you. Hello, can you hear me?
Yes, sir.
Okay. Okay, thank you. Now, causes of male, these all I discussed. Now, what is the policy program solution? Then what WHO response? Research, epidemiology, etiology of infertility, policy making, dialogue to create enabling environments. See, in our government, we don't have a special infertility clinic because of excess population that is going on. So even in allopathic hospitals, the infrastructure in research is very less. That's why the private organizations are coming to treat infertility, which we don't find in our government hospitals. Guidelines for prevention and diagnosis and treatment of male infertility and female infertility, collaboration, academic centers, ministries, UN organizations. There is no collaboration even in conventional or allopathic system of medicine or head of the departments of gynecological surgeries. The infertility is even in allopathic hospital is in research status, but not as a treatment or as a disorder, as a disease. Now they are not taking place because India, with full of population, we have various disorders to be treated. So when these disorders, particularly malignancies, diabetes mellitus, hypertension, bronchial asthma, rheumatoid arthritis, various systematic disorders, so there is nobody to concentrate on infertility, and now the infertility is becoming one of the best clinics, particularly for homeopaths, because if allopathic doctors treats with IVF and surrogate mothers, out of 100 cases, they fail in 30% of the cases. Those 30% of the cases will go to homeopathic doctor, and it is their duty to understand the modern knowledge that is being taking place in conventional allopathic system of medicine, as well as scientifically treating the patient with homeopathy is another way of treatment. Now it is not so much laborious for homeopathic doctors to practice with homeopathic medicines, like referring a detailed case sheet, a drug that has to be worked out. Many patients would be depending on something which we usually assume and which are not present, and thinking of miasmatic approach, which I never deny, but at the same times the miasmatic approach is not being found in research, so which we cannot apply the miasmatic knowledge. We have to apply our concepts to the research that has been done, but our predecessor have done lot of work to treat the infertility cases, and they have written wonderful therapeutics. When we have taken the literary research, we have found various drugs that are most useful for treating infertility in female as well as in males. But each study needs around minimum 3 months duration to 1 year of duration, along with the investigations with each drug. We selected around 20 drugs, but we could complete the study only on 2 drugs, particularly with Agnes castus and Murex. Why we have taken these medicines to be carried out in the research in the first hand? Because the literary research, the drugs that have been used, apart from Silesia, Lycopodium, Natrimur, Palasatella, Sepia, and Agnes castus, Yohimbinum, um, see other medicines like alfalfa and ginseng, and male impotency, Lycopodium, Epatconium maculatum. These, the Agnes castus and Murex, have been used very much, apart from and more than the number of Natrimur and Palasatilla. So we have taken this study. This is my fifth lecture. From the lecture 1 onwards, previously, before that, around 6 months back, we started this research, and in this research we could complete only two medicines. One is Agnus castus in male and Agnus castus in female. The mechanism of action of medicine of Agnus castus and the biological activity and the pharmacological action of Agnus castus and the herbal activity, the genesis, the structure of the Agnus castus, everything has been seen. But here, because of lack of time and more laborious research, scientific oriented methodology, I made it easy and prepared a slide from my research study which was being carried out with a gynecological institute on infertility, a special branch in JIPMER, where to selected around 9 cases. Why the 9 cases means 9 cases will give the most probable biostatistics reference. So if we don't see any case on nine patients, and if we don't compare them with placebos, and if randomized controls are not being taken, that will not come under the proper serological method. So when we have decoded with randomized blood samples, and when we have taken Agnus castus, we found out of 9 cases, we have enrolled around 14 cases, but 2 cases have been dropped out. 2 patients were not interested to take homeopathic treatment. So I lost 4 cases around that. Only 9 cases were observed. Out of 9 cases, the 6 patient reference, fortunately, coincidentally, 3 patients came under male and 3 patients came under female. See, Agnus castus in females is really surprising for homeopathic doctor to listen these words, because the materia medica of Agnus castus never gives any symptoms that are belonging to female. So let us see what was the WHO response. The WHO this time, recently last week, has carried out a seminar and a get together, a summit on traditional systems of medicines. But the government of India, despite a full developed homeopathic system of medicine, they haven't given any opportunity the homeopathic success to be discussed on the platform, because the homeopathy in other countries is deemed as a placebo effect, except in India, Pakistan, Bangladesh, Sri Lanka, Nepal, South Africa, and Brazil. So rest of all the degrees and diplomas that have been offered by either in London or in America or in Switzerland, whoever goes there, whoever speaks about homeopathy, whoever gets the degrees and diplomas, they all will just show off, and they will make blowing out of proportion just for their survival, but to not serve the system scientifically. So these are the WHO response. The technical support is country level implementation of infertility services. Then references, these are the references. Every research study will have a references, even on Agnus castus, which I have carried. I will show you the response. Now we will go to today, because lack of time, I have to speak about homeopathy as well as research on Agnus castus in females and males, and its mechanism of action. Though I completed Murex also, I could not prepare the slides because I have to work on data. But whatever data that is available with Agnus castus, I will speak about Agnus castus, and I will see that I will finish in time. So I will go for my third part of sharing. And can you see, madam?
The slide
Can you
is
see my
Yes, sir. Yes,
slides?
sir.
Yes, sir. Now
Yes,
this
sir.
is
We can see.
Agnus castus. Yes, sir.
Causes
Tell
of
me, sir.
male infertility.
Yes, sir. The Agnus castus usually deemed as a medicine for male infertility. But when we have tested the hormones that it was affecting was entirely different. It was a functional medicine. It is a very good medicine for male infertility as well as female infertility. We can try this medicine if coupled together come for treatment, so we can find out the defect with whom the infertility has been produced in the family. So we can apply the Agnes casters. There you need not go for unnecessary presumptions. You can take the mental symptoms, the personality defects, and the local social problems of the particular patient. But once the medicine enters, it has to go and act, it has to remove the pathology, so it has to go through bloodstream. Then only the net results will be found. In any case, in any treatment that has been given by homeopathy, and all these days the homeopathy has been rejected because the mechanism of action of medicine is not known, and the power of the medicine, the quantity of medicine that is present in potencies is also not available. So, but as a researcher, not to enter into controversies, we have taken low potencies medicines, that is up to 12x, 12c, and despite of all these things, when we have seen literature, even the 30c was acting. So we have maximum, our potency is 30c. We never tried 200, 1m, 10m or 50m or cm. Though the ultra dilution study shows there is success in some of the articles, but when we tested ultra dilution, even for spectrometry, we could not find anything. There is one nanotechnological particle, but those particles, when we taken picture, they were not showing any difference of the particles picture in 30C, 200C, 1M and 10M. Moreover, the clinical transformation of the drug has not been taken place. The clinical transformation of the drug into action took place up to 12C potency. After 12C potency, in one case of 30C potency, it has been taken. We have to discuss that case. We have to re-verify the pathological conditions. We have to re-verify the biological activity, and we have to test again. But fortunately, what happened? That woman also became fertile once the successness of Agnes castus has been proved. The Agnes castus has been prescribed for all 13 cases that we have taken. 4 cases have been dropped out, and these 9 cases will belongs to only Agnes castus, and another 9 cases to Murex. And every medicine that has given in the literature that is found to be highly effective, basing upon the constitution of the patient. Again, here the homeopathic materia medica, those stringent materia medica won't work out, in the sense we have taken repertorization, a detailed case history, and the personality, physical, mental, aptitude, and social attitudes were taken into consideration. And will have including criteria and excluding criteria. We haven't tested our medicines on alcoholic patients, on patients with infantile uterus. We have taken the medicine where the infertility was possible only because of the semen count that is totally nil, and the female with inappropriate gonadal hormonal action. So we will see the what happens. The Agnes castus in infertility. What are the symptoms we usually see in our materia medica is sexual debility. What is the sexual debility? Is it impotency? No, it is not at all impotency. We are not talking about impotency. Infertility and impotency are entirely different. Impotency may be because of hypertension, diabetes, neurological, accidental, and impotency, hypothyroidism, some other disorders, and aged condition. But a young couple coming after marriage and not conceiving for more than 1 year is our infertility definition. but they are coming after 5 years after trying all the types of treatments. So here the patient that have been selected are after 5 years of their marriage, and here the sexual debility never works. So we have to take hormonal imbalance and suppressed vitality. What is this vitality? The vitality is taken as a strength. It is not suppressed, but because of inferiority complex, because of masturbation during the young life, he might have had some preconceived notions which has to be removed through counseling and education. So its action is most prominent in condition marked as loss of sexual desire. Why the sexual desire is not coming? Because the hormonal level is totally imbalanced, particularly functional gonadal insufficiency and endocrinal dysregulation. What is this endocrinal dysregulation? When a gonadotrophic hormone is insufficient, it never creates and impacts on testosterone. Naturally, the testosterone will not have effect on growth hormone. When there is no effect on growth hormone, there will not be a secretion of dopamine and serotonin. So there will not be any affection, and the patient will be always unsocial, and patient never mixes with women. He always feels the inferiority complex. That's why the word suppressed vitality has came. But the suppressed vitality and sexual loss of sexual desire is because of the hormones that are pathologically affecting the patient. So the hormone imbalance in a male patient is leading to lack of sexual desire, not because the word has been written. So Materia Medica also in future, if competent research in an institution takes place, we also can change many words and their meanings, and the pathological application will come there, like what Hahnemann did around 200 years back. He used China. It produces egg fever. That's why it cures egg fever. Now we can rewrite our Materia Medica. The lack of sexual desire in Agnes castus is lack of gonadal trophic hormone insufficiency, ultimately leading to lack of sexual desire. He will not have erectile dysfunction. His spermatogenesis will be normal, but mentally he will not have desire for romantic life. So there the Agnes castus must be prescribed. Then involving the hypothalamic pituitary gonadal axis. I told you this is what the hypothalamic pituitary gonadal axis. Gonadotrophin ultimately leading to pituitary and the posterior pituitary gland instructing the testosterone to be secreted. Testosterone in turn will work on testes, and the epididymis of the testis will produce spermatozoa. Naturally, it will go to growth hormone, the muscular development, the mustache, and the power, and the muscular power will come. That will have effect over the serotonin and dopamine, which will create a interest towards male or interest towards female. So that cycle, the hypothalamic pituitary gonadal HPS axis is being disturbed. How this has been understood? When the continuous prescription of Agnes castus from 6C potency to 12X potency has been done, there is a change in hypothalamic pituitary gonadotrophic hormone, and it has increased. Then why it has been decreased? What is the defect? No defect at all. All he needs is gonadotrophic hormone. But when the gonadotrophic hormone has been induced by conventional medicine, it also increased the testosterone. Naturally, the excess testosterone has created antibodies. That antibodies has killed the spermatozoa that is alive, and it reacted with vaginal fluid, and that vaginal fluid cannot carry the live spermatozoa into uterine cavity. So he is own responsible for his immunological deficiency, where the Agnes castus a simple dose will rectify that mechanism, and the gonadotrophic hormone will act, and the testosterone will act in its own axis with the help of homeopathic treatment. In usually when we carry research in allopathic hospitals, they will ask us to show the treatment response or the research response within 6 months, because number one, the ethical committees never allow us to treat the patient, because homeopathy is having a defect which has been caused by our adults, the senior most persons. That is, we never proved our medicines on animals, but at present it has been proved that the veterinary homeopathic medicine is more successful than the human homeopathic practice. This is unfortunate. Our predecessors, even after establishing wonderful government research institutes, they were having lack of confidence. Now after their retirement, and now when they came out of their institutes, they feel very pity, and they will tell that we could not do anything, and they write articles like homeopathy is at crossroads, homeopathy do not have evidence. It is they themselves responsible to be in higher post and not doing any work. The reason is they do not know who is a very good homeopathic doctor, gives the research ideas, and where to carry, when to carry, and how to carry. These were the defects of all the highest official think tank that worked in homeopathic institutes in the government, and ultimately has closed the future of homeopathic life. And a person like me and many few are forced to carry out the research and say, and always we were in the convincing mode of conventional modern technology. Not conventional system of doctors are very helpful, but when we are reading, when we are in between so educated persons, we were always forced to convince them, because the modern science and technology has developed so much. Then the second action is, what is the mechanism of action? The neuroendocrine regulation. This is known as central action. The first level 1 action is it acts on hypothalamus. Then how to find out the hypothalamus action? Take the fluid, take the test the serum, and how hypothalamus is being regulated. Whether the patient has been recovered from his depression, the lack of sexual desire, easy participating, easy talking with his wife, how his social structure has changed, easy going to office and talking with the officers about his election card or his ration card, easy in a position to do his work, or whether he is a company person. These all are just defects in hypothalamus mechanism and gonotrophic mechanism. Modulating gonotrophic and RH pulse variability. This we can conduct with the blood test. Then pituitary gland. We have to take the MRI scan of pituitary gland to avoid any mass or growth or something. But usually that will be understood by the symptoms. Despite of that, we have taken that. Regulate prolactin, luteinizing hormone, and follicle stimulating hormone in females. Gonads are common hormones for male and females. Prolactin, luteinizing hormone, FH hormone for females, and improves. What is the improvement of the functional response? Whether the menstrual cycle is regular, whether the bleeding is normal, whether the bleeding blood contains ovary or not. See, carrying out research is very tough task. The government never gives funding, so we have to carry from our packet, we have to take permission, we have to spend. So that is being carried out. See, spending over 9 cases may cost around 1.5 lakhs. So carrying out that is not a big problem for a person like me. Fortunately, I have enough resources. So the key mechanism of dopamine re-energetic activity, I told the gonadotrophin, testosterone, and the dopamine. The agonistas act as a dopamine D2 receptor agonistic. See this, how we will found out, because we have a immunology department here. We have a endocrinology department here. After giving continuously the Agnes Castus dose, see, research is different from clinical type of prescription. The drug has to be converted into clinical activity medicine. A drug is that is being tested on human beings, whereas a medicine is that is being tried for the disease. So when I am doing this clinical experiment, these reactions will be different. When the patient comes to your clinic, you have every freedom to prescribe. You need not carry out the research. Your research is an excellent case record, understanding and having the knowledge of hormones and infertility. So that what is happening, what are the roadblocks for cure? Here we never see the roadblocks for cure. Here we see where the medicine is acting, how the channels, what is the mechanism of action of the medicine. So a research outcome I am giving to you, because you will have a confidence that Agnes Castus can be prescribed to young couple, whether it is female infertility or male infertility, because it is having so much of mechanism of action, and it is not an assumed mechanism of action. It is an observed mechanism of action. It is not from AI. You won't get it again if you try AI or computers or online. So dopamine inhibits prolactin secretion and reduced prolactin, restoration of gonadotrophic LH, luteinizing hormone, and FSH, follicle stimulating hormone axis. See, in females, it will decrease, reduce prolactin, whereas in males, it will increase the dopamine. The dopamine is agonistic, inhibits prolactin secretion. Inhibition means not increasing or decreasing, just it is only charging, giving a kick, and that will restore the immunomodulation. The immunomodulation in females is reduction of prolactin. The immunomodulation is males is increased prolactin. So one should, a homeopathic doctor as a researcher, I was forced to go for training daily 1 hour for a week and studied thoroughly the hormones and hormonology, endocrinology, particularly that is connected to infertility. Then reduced testosterone and spermatogenesis in males. Now I told, you can see in this slide, reduced prolactin leading to luteinizing hormone, follicle stimulating hormone axis in females, and reduced testosterone and spermatogenesis in male. When the spermatogenesis means the sperms will produce, but they will have half-life and they die once they reach the vaginal mucosa, and 50% of the spermatozoa will die, and if they are less than 50% spermatozoa, the fertility won't take place. So these all must be observed. Then mechanism in female infertility. See, I am talking about Agnes Castus, which the Materia Medica boasted about male infertility, male lack of sexual desire, male lack of sexual hormones, making the penile dysfunctions into normal. But that pathology is entirely different from these female studies. We never expected, but when we found when we are conducting, the blood tests have been found out, when the autoimmunological immunogenicity, IgE, IgA, and Ig antibodies were found out, we are really surprised. And when we referred to Materia Medica, we also found in one of the old textbooks of Materia Medica by Dhanam, thus Agnes Castus also can be tried in females. So those persons, some of them did work without their knowledge, somehow they did excellent work, not knowing, and always criticizing allopathy. The allopathic doctor attitude is not up to the mark, but the allopathic medicine is always a science which we have to take the help and make our system as scientific. In future, we also now got the AI applications. The homeopathic science is going to become more scientific. Nowadays, the animal proving is also going to be banned, and we have to prove our medicines without animal or human response, depending upon the AI. By that, the homeopathic system is having a little facelift.
Dr.
So, where
Prakash
we
Rao,
can be. Yes.
we have only 2 minutes more.
Yes. Now 2 minutes, that is too much for me. So pathology, lutein having low program, amenorrhea, loss of libido. Then acts on functional sterility, not structural pathology. Functional sterility means lack of desire for lack of sexual desire, particularly indicated when infertility is accompanied by coldness, depression, indifference of sexual relations, and history of grace and too much of masturbation or onanism. See, onanism not having anything, but onanism is having a personality defect where that will work for us. He thinks that he is depressed, but as for medical psychology, parapsychology is concerned, it is not wrong. So these are the conditions in male infertility. And see, condition, therapeutic action, and you can see erectile dysfunction, oligospermia, sexual exhaustion. These all in therapeutic action are different. Restore sexual desire, improve neurovascular tone, enhance spermatogenesis signaling, correctness of nervous debility. So Agnes casters may influence cellular energy, epigenetic signaling. In homeopathy, ultra dilutions are taught to act through water structure, memory. These all are the concepts that are based only to satisfy. I have written, but they are not found to be clinically effective. Nanoparticle and biofield resonance, because you are reading those papers, but the nanoparticles have not been converted into medicinal particles into curative clinical aspects. So domain action, neuroendocrine, hormonal, reproductive, nervous system. What are the action? Dopamine medicated, restores LH, FSH, improves ovulation, spermatogenesis, reverse sexual debility, corrects the function of infertility. So clinical indication, complete loss of sexual desire, coldness, mental depression, sterility without structural pathology. Sterility without structural pathology is main important symptom of Agnes casters and infertility. History of excess or grief. These all are social aspects because of lack of children. And this is the end of the slide. Thank you very much, Manoj sir. Thank you, Daneshji. Thank you, madam. Thank you, Dr. Kurup. Thank you, Kalyan Saab. Aaya kya? Thank you very much.
Thank you so much, sir. Thank you so much. A wonderful
Thank
session.
you.
Actually, it's a great success for us. And I am inviting Dr. Ram Parvesha, sir, for giving out of thanks to
Ram Parmeshwar ji,
Thank
ये
you.
actually
Thank
एक
you.
workshop, एक
Thank you,
seminar है.
Anjali. Congratulations, sir.
नमस्कार नमस्कार देख रहा हूँ
Congratulations.
पहले से नमस्कार.
Wonderful presentation. And presentation, wonderful and very good. And there are three engineering. Fertility, infertility, there are three engineering: lifestyle and environmental factor. Environmental factor. The lifestyle, electrical engineering disturbance. Yani Chitjal Pava Gagan Savira. Electrical engineering disturbance, the obstruction and disturbance of endocrine glands and dopamine, LH, FSH. So, electrical engineering disturbance and infertility is the infertility then start.
सर जी होम्योपैथिक डॉक्टर्स ने बहुत काम किए हैं, मगर क्या काम किए हैं? दे वर नॉट इन ए पोजीशन टू प्रूव.
बहुत बहुत धन्यवाद सर. अगेन प्रेजेंटेशन.
नमस्कार सर.
यहाँ पर
सर ऐसे 20 रेमेडीज है द मैकेनिज्म ऑफ एक्शन. इसमें अब स्टैटिस्टिक्स का पार्ट भी छोड़ दिया हूँ क्योंकि इट वोंट बी कवर्ड इन 1 hour. एक्चुअली इट इज अ सेमिनार, 1 day seminar, but we have to
all presentation research work is a very good presentation.
Thank you, sir.
And Ghar Ghar Homeopathic,
Thank you,
very
sir. Thank
thanks,
you.
sir.
Thank you so much,
Parvesh
sir.
you can try
Now,
Acnes cascus in your clinic without बिना रोक टोक आप प्रिस्क्राइब कर सकते हैं and
Thank
you
you.
will find positive results. Thank you very much,
Thank
madam.
you
Thank
very
you.
much, the whole participants, and thank you so much, Prakash Rao, sir. Now we are handing over the session to Dr. Mariamma John. This is the end of today's session, and this is the last English session of this year. Thank you all the participants for your support and participation here. Now I am inviting Dr. Mariamma John for moderating.
Happy New Year, 26.
Happy New Year to everyone. Happy New Year to everyone. Thank you. Dr. Mariamma John, you are welcome.